summers are approaching in doctor, so can you tell us what is the perfect skincare routine depending upon our skin type?
Suppose someone is having very oily, sticky skin. Summers में generally people have this complaint that skin is very oily, sticky, and they don't want to put any kind of moisturizer.
So doctor, can you tell us that which is better? Like we've always heard about hair transplants. Now this exosomes is something which is new that has come. Good skin is something that we all dream of. Who doesn't want to look beautiful? But for that you need the right dermat who can guide you to use the right kind of products and the right kind of treatments. So today we have with ourselves Dr. Apoorva Singh, who is a renowned MD dermatologist and who's been practicing from past 11 years in Indirapuram, Ghaziabad. She also has a clinic in Indirapuram by the name of Aesthetic Dermatology Clinic, and she has also previously worked with Max Clinic. So without further much ado, let's get in conversation with Dr. Apoorva. Good morning, doctor.
Good morning.
How are you doing?
I'm very fine. How are you?
I am doing great, and we are honored to have you here.
Thank you.
Yeah, and our audience definitely wants to gain all the knowledge about good skin. As the summers are approaching in doctor, so can you tell us what is the perfect skincare routine depending upon our skin type? Because one skin type does not suit all. Some people have dry skin, some people have oily skin, some people have combination or sensitive skin. So how can we take the best care of our skin?
In summers, we need to take special care for our skin. Most people think that in summers you can skip moisturizers, and people think that for summers only you have to use SPF and sunscreen. So just like sunscreen is meant to be for throughout the year, so moisturizer are also meant to be round the year. In summers, according to the season and according to your skin type, आप अपना sunscreen and moisturizer, face wash, you can change your products, right? Suppose someone is having very oily, sticky skin. Summers में generally people have this complaint that skin is very oily, sticky, and they don't want to put any kind of moisturizer. For those cases, moisturizer is always recommended after wash, but it can be a very lightweight gel-based one. But because moisturizing is something, it's an integral part of your skin. You cannot skip, even if your skin is oily. Okay, followed by a gel-based or matte finish sunscreen that can be for the oily skin. Plus, the face wash that oily skin person opts for, it should be oil control one. Okay. Similarly, if someone is having very dry skin type, for that patient, this face wash would be something that is more hydrating, ceramide based, that leaves your skin, well nourished and hydrated, doesn't dry it up. Followed by the moisturizer that also contains good amounts of hyaluronic acid, ceramides, that hydrates your skin from deep within. And moisturizers are also these days available that are mixed with hydra factor, like hydration part is there in the sunscreen as well. For a normal skin person, they can always go for a normal face wash, not very hydrating also, and not very lightweight or gel based. Similarly, they can go for a regular moisturizer, not very thick nor a gel based. Sunscreen also they can opt for a gel version or a lotion version. They don't need to go for a hydra version of sunscreen or a totally non-sticky transparent gel type of sunscreen. But be it any season, you cannot skip your sunscreen and moisturizer.
And how about sensitive skin, doctor?
For sensitive skin, the products should contain hyaluronic acid. After face wash, you can apply hyaluronic acid over your face, followed by a good ceramide based moisturizer. And you should take care while applying AHA, BHA and these acids. People generally with sensitive skin, they apply a lot of actives on their face at the same time. If you have a sensitive skin, the number of actives should be limited and always under your doctor's supervision. That is the best part. For the sensitive skin, the main thing is repair of the barrier and maintaining the barrier. Okay, and for that, hyaluronic acid and ceramide, these two molecules are the best. Always look for these two in your face wash, moisturizer, sunscreen, whatever products you apply, and limit your actives.
So now coming to the most common concern that we all have, starting from teens to people even in their 50s, everybody is struggling with acne, and people just don't know what kind of right products to use and what are the reasons for acne and how can we control it, because as you know, doctor, prevention is better than cure. So can you throw some light on this?
See, acne generally starts during teenage, And for some patients, approx 10 to 20% of the cases, it goes until adulthood also. And there is another type of acne that is called adult onset. Like people would come and say teenage में we never had any acne, but now suddenly in our 30s or 40s we are having this. So first we have to find out the reason behind it. Teenage acne is also induced by hormonal changes, and at times the adult acne is also induced by hormonal changes. After 40s or maybe in 50s, females would come during the perimenopausal phase. Due to hormonal changes, they might get acne. Okay, and other reason for acne can be excessive oily skin, not applying proper products, using lots of hair oil. Like it's a myth in India, everybody thinks that applying hair oil is something that is beneficial for the hair. They don't realize that his skin is already oily. They're putting a lot of oil over that. They're not using oil control products. So that will lead to aggravation of it. Identifying the cause, how is your skin type, what kind of products would go for it, that is the first thing. Secondly, is it hormonal or non-hormonal? Generally in cases of females, PCOD or perimenopause is the most common cause. So treating just acne superficially and without addressing the root cause won't give you much results. It will be like just off and on. This acne would come and go, no permanent results. For that, you just have to identify the cause, fix the root cause along with acne. But acne is something, if treated on time, it gives fantastic results, followed by scars also. Many people, they don't go for treatment. They think कि age related है. Generally, parents of teenage kids, they come to us and they say, treatment किसके लिए क्या जरूरत है? ये तो age related है. सबको हुआ था, अपने आप ठीक हो जाता है. But they don't realize if you don't treat it on time, they will leave permanent marks. And sometimes patients come in their late 30s and 40s. कि ना, we had acne in our teenage, we didn't treat it that time. Now, can you fix our scars? So at that age, it's very difficult.
It's very difficult.
मतलब the thing is, आप scarring phase को जितना delay treatment start करेंगे, उतना ही the treatment is tough for us to do it. और जितना initial stage पे you fix the active acne plus you target the scars also, it will go very quickly and the result will be much better. अगर आपने teenage में ही करा होता. So that's what I educate all of my patients. Acne तो आपका settle हो गया. Now the leftover scars, उसके लिए whatever the procedures we suggest, suppose peels हैं, fractional lasers हैं, RF है, microneedling है, PRP, whatever I am suggesting, it's best time to do it right now. They think acne settle ho gaya, now our kid is into 10th or 12th, they have to focus on their studies. Let's not go for these procedures, we'll see later. When they grow up, if they feel, they'll take it on their own when they're adult enough. So that is something parents need to realize. Kids are just, they are just school going kids or college kids. They cannot take decision. But parents need to realize, sooner you treat it, the better the results are.
Also, मैं ये जानना चाहती थी, क्या diet also plays an important role in acne या फिर इसका diet से कोई लेना देना नहीं है?
Directly diet से relation has not been found. There are no studies that can prove directly acne is related to any kind of particular diet. But in case of people having excessive oily skin, excessive oily scalp, we tell them to avoid oily food because sugar has found to be, responsible. Excess of sugar, excess of milk and milk products, they have found to be, responsible in very few studies. Very limited data is available scientifically to prove it. Okay, but in case the patient is being diagnosed with PCOS, that is PCOD, in that case, diet plays an important role. Those patients have to reduce their weight a lot. They have to maintain their weight. So their diet plays a lot of role in the PCOS cases.
Coming to the next important topic, that's another thing that a lot of people struggle with, that is pigmentation. Exposure to the sun or exposure to treatments or some internal changes. There could be many reasons for it. So let's ask Dr. Apoorva. She can guide us better as to how to control pigmentation.
See, pigmentation also similar to acne, we need to identify the cause for pigmentation. It can also be attributed to hormonal changes, like many women get it during pregnancy and post-delivery also. And it can be due to your lifetime sun exposure also. Like throughout the life, if you have been not very regular with sunscreen, you've been thinking like, theek hai, I'm fair enough, I don't need, I'm not going to tan, and they skip sunscreen throughout their lifetime. So after a certain age, just like you get wrinkles, sagging, pigmentation is also one of those signs of aging. After maybe 40s, 50s, you'll start getting pigmented patches. At that stage, patients say ki mere this relative and that friend that is also my age. Why don't they have? Why do I only have? So that is the reason. They might have been lucky to have a better skin type genetically. Secondly, they might be quite regular with sunscreen throughout their lifetime as compared to you. That is the reason. So sunscreen is something that is recommended for everyone above 6 months of age. In India, still many people don't, feel the need of applying sunscreen. Especially for kids, they are like shocked. अच्छा, kids को भी लगाना चाहिए. इनके लिए तो धूप बहुत अच्छी है, इनकी immunity बनती है, and all of that. They don't realize, And adults also, they always have this point of argument like, अगर हम sun में नहीं जाएंगे तो vitamin D low हो जाएगा हमारा, all of that. So for pigmentation, only preventive thing is sunscreen. That is the only thing. If you have been very regular throughout your lifetime, there are very, very low chances of getting it. If you have a blessed skin genetically, then there's almost nil chances that you would get it. थोड़ा genetics का role होता है, थोड़ा सा आपके cosmetics का role होता है. If you have been applying a lot of chemicals over your face, also hair dyes, the fumes that come out of hair colors and hair dyes, they are responsible for pigmentation over this forehead area. Many just over the forehead. The reason behind that is either they have been applying a lot of wigs and balms for headache, or they have been applying very strong chemical like hair dyes and hair colors that doesn't suit them. So same brand, some particular person have been applying, unko nahi hoga, but same brand some other person have been applying, unko ho jayega, because they are sensitive to the chemical. So a lot of things play a role in the pigmentation. So you have to address all of it. First, identify the root cause. What kind of pigmentation? Which part of the face is it? So what can be attributed to it? Like, is it due to sun exposure, due to chemical exposure, due to hormonal changes? At times there is some post-inflammatory hyperpigmentation also. You get any rashes or some suppose कोई allergy होगी, acne हो गया, patient bursted up, right? क्या habit होती है, खुजा दिया, burst कर दिया, या कोई wart या कोई skin tag आया, किसी के कहने से कोई chemical लगा लिया, कोई दवाई किसी के भी कहने से लगा ली without asking what, that leaves a black mark. So many times that is also responsible.
So doctor, अब जब जिन लोगों को pigmentation हो चुकी है, अब उसके लिए क्या best treatment options है हमारे पास?
For pigmentation, there are a lot of treatment options. Apart from few tablets that we give, few application that we give, the most important thing, part of the entire treatment and the regime is sunscreen that you have to follow during the treatment, after the treatment also. During the treatment, suppose you're very regular and after treatment you stop it or you switch to these OTC brands. That very moment it will be a rebound. So apart from the creams, sunscreens, tablets, there are few procedures also they help to very good extent. Like there are varied range of peels, mild peels, moderate peels and deep peels that work for pigmentation. Lasers that work very well for pigmentation. Microneedling, skin rejuvenation, a lot of procedures are also there along with the treatment. But it's not like a patient is going for peels or lasers, they don't have to apply anything at home. Home care is as important as the procedures. So at home they have to take care on daily basis, stick to the sunscreen, and then the results would be there. But it is something that rarely it gives 100% removal if it's quite deep and quite old and darker. If it's epidermal pigmentation that is just brownish, slightly darker than your normal skin tone, then it's got very good results. Black and dermal pigmentation, then the results won't be that much. Like many patients expect 100% chala jayega. For pigmentation, like achieving up to 70 to 80% reduction is also fair good enough, but it requires time. अगर आप timely आ जाते हैं, epidermal pigmentation है, तो there are chances you can achieve 99 or 100% also. But it requires regular, long treatment procedures and a lot of care from patient side.
Now talking of sunscreen, as you mentioned, so how many times ideally we should apply the sunscreen in a day?
See, there are two types of sunscreen applied, physical and chemical, and the third one is combination. If you are applying a chemical sunscreen, generally most of the people like that, because once you apply it just absorbs in your skin, completely transparent, it gives you matte finish and all of that. That is something that is a chemical based. Once you've applied it, it will stay for 2 to 3 hours. After that it's gone. Okay, so if you're in sun for long, yeah, repeated in out हो रहा है, suppose in market or something, या आपका ऐसा job है marketing में हो या something that you're continuously out, then you have to repeat every 3 hours. Suppose you're applying the physical block. Physical block is something that contains zinc oxide and titanium oxide. It forms a little bit of whitish cast. When you apply it would settle in few minutes. But physical block is something, if you applied nicely in good quantity, you don't need to reapply. Okay. Generally for people who have got outdoor job, I always recommend physical sunscreen. Until you wash it off with a proper face wash, 10 hours, 12 hours it's going to stay.
Okay.
So for people who've got generally indoor jobs or office गए and rest of the day they are inside only. For that, chemical one is okay. But the people who are right out in sun for long, I always recommend physical block. That does not, that doesn't require repetition at all.
That is such an interesting fact. Like, I also didn't know about these two types of different sunscreens, so that is a revelation. So coming to our next important topic now, with some people have acne. Now talking of pimples, now that is like, adolescent related, but even I think even elders have it. So what is the exact skincare routine that we should follow if we get pimples, and the best ways to avoid it?
Best way to avoid is not using a lot of actives without consulting your dermatologist. Many a times, 1 or 2 acne, if you're getting here and there, they can be due to irritation of your skin, due to actives that you're applying, a lot of actives at the same time. Plus, if you have a full-fledged face filled with pimples and acne all over, then you need to seek medical help. Prevention case is going least by your products. Like, the number of products that you apply should be as minimum as possible. If oily skin, go for an oil control face wash, lightweight moisturizer and sunscreen. That is also gel based, that's it. If you have very dry skin, then go for hydrating all these products, moisturizer, face wash and sunscreen. Still, if you get a lot of acne, then you need to seek help from dermatologist.
Okay. So doctor, now this very, very interesting and important topic that everybody wants to know. Everybody wants to preserve their youth. Everybody wants to look young. Nobody wants to look their age. So can you tell us some anti-aging treatments which are non-invasive? Because a lot of people are very scared of needle and procedures, which can be very, very invasive. तो आप हमें कुछ ऐसी treatments बता सकते हैं हमारी audience के लिए जो completely safe है और जिनका effects are really good?
Anti-aging, if you want your face to be lifted up and the sagging is there, you have little bit of bulky lower face, or patients who have double chin problem, you can always opt for HIFU. What is HIFU? It is high intensity focused ultrasound energy. It is just like a laser machine. We do a sitting. A single session would hardly take 20-30 minutes.
Okay.
It's almost painless. We apply a numbing cream and then you won't feel anything. Needleless, no pain, no injections, no risk. For people who are scared of injections, who thinks, oh, Botox filler तो कुछ है जो हमको नहीं चाहिए, उसमें तो ये हो जाएगा, उसमें वो हो जाएगा. Many people have a lot of myths and reservations against those. They don't want to go for it, but still they want something anti-aging हो जाए, face lift भी हो जाए. So HIFU is your the best option for that case. It gives you instant results. Within next 2 weeks, you'll see your face is lifted, your double chin is gone, your lower fat bulky face, it's all shaped up. So it's got very good results. At times need to be repeated 3 to 6 monthly, and for some patients it can last for more than that also.
Okay. So ideally अगर हम बात करें तो हमें HIFU की कितनी, समझ लीजिए हम बात करते हैं डबल चिन पेशेंट की, तो उनको कितनी सिटिंग्स में अच्छा रिजल्ट आ जाएगा?
In a single session.
There'll
be result in a single session. But the single session, because it is something that is related to signs of aging. With age, your face will be sagged, wrinkles भी आएंगे, थोड़ा लटकेगा, झुर्रियां भी होंगी. So it's not something I do it today, you get the result and it will stay for permanent, right? Lifelong तो नहीं रहेगा. Single session में you'll get good results, but they will start to wean off after 3 to 4 months. So patient can always redo after every 4 to 6 monthly.
Okay. तो ये कोई भी करा सकता है या इसके लिए भी कोई restrictions वगैरह होते हैं, या ये किसी एज ग्रुप में, क्योंकि आजकल बहुत सारे यंगस्टर्स भी हैं, कईयों को बहुत chiseled features चाहिए होते हैं, so they want to lift up probably the jawline or neckline. तो ये क्या कोई भी करा सकता है या कुछ इसके अंदर restrictions हैं?
Anybody can go for it. It is basically for your chiseled jawline, shaping of your lower face, double chin. There's no age limitation. Obviously the patient has to be above 17-18, but upper limit कुछ नहीं है. And कोई downtime नहीं है moreover. For other lasers, sometimes there is downtime. Like there's some redness, you don't have to go out in sun, or there'll be few marks, or there's something on the face that you don't want to, go, you're not comfortable stepping out. There is zero downtime. That very moment, the moment you get the sitting done, there's nothing on your face. No marks, no redness, nothing. No restrictions, no aftercare, nothing.
अच्छा डॉक्टर, नाउ कमिंग टू द मोर इन्वेजिव ट्रीटमेंट्स. अब हम बात करते हैं बोटॉक्स और फिलर्स की, जो बहुत ही पॉपुलर है विद सेलिब्रिटीज, इन्फ्लुएंसर्स, आजकल बहुत लोग इसके लिए जाते हैं, पर क्या बता सकते हैं कि ये कितने सेफ हैं? और हम कई डिजास्टर्स भी बहुत देख चुके हैं, चाहे हॉलीवुड के अंदर चाहे बॉलीवुड के अंदर। तो आप में बता सकते हैं कि हमें कितनी क्वांटिटी या क्या इसके पैरामीटर्स होने चाहिए जिससे हमें लुक एटलीस्ट नेचुरल लगे? बिकॉज एट द एंड ऑफ द डे आप बिल्कुल अपने जैसे लगने चाहिए, आप कोई एलियन नहीं लगने चाहिए।
Yeah, many people overdo these things. Being over enthused about Botox fillers and injecting a lot at the same time is what I always discourage. I always start my patients with the lowest possible dose. I tell them I am doing under treatment for you. Suppose a patient requires 50 units of Botox at a single session. I would, for the first, if he's or she is going for the first time, on the first day I would just give 20 or 25. I'll give it. I'll say him or her to go see your results. After 2 weeks come back to me and then you tell me कि यहाँ और यहाँ अगर हम थोड़ा और lift कर दें तो I'll be fine with that. So similar way I always go. Suppose a patient is going for filler for the first time. For the first time I'll just give 1 ml, half and half. I explain them. Say, see, now this is your face. After 3 or 4 weeks this much would be lifted. If you still feel that further I can increase like 20-30% lift more I can go for and still it won't look abnormal on me or artificial on me, then I can always redo. It's always good to undertreat and then top up as per the patient's requirement. If you overtreat on day 1, then whatever the results are, most of the cases they are non-reversible also. A few points at the Botox you're not able to reverse it. Okay, filler is to some extent reversible, but also that process is painful. It's not like जितना filler में आपको pain नहीं होगा, reversal would be 2 times or 4 times more painful than that. So it's not always easy and convenient and very safe for patient to go for the reversal. It's always advisable. Start always underdosing, then always top up when you feel. Like after 2 weeks after Botox, I always call my patient. Then I top up a little bit more, then little bit more every time. Similarly, patient would get a confidence like, yeah, I took 25 on the first sitting and after 2 weeks then I took 25 more. Now once I have 50 units of Botox on my face, this is what my face looks like. So next session when he or she comes, he would say like, I'm okay with that one, give me 50 on one go. So that is fine. That way I would go. But there are people who encourage, I don't know why, but maybe for money making process or what, they encourage for the patient. If the patient says I want 50, they would anyhow try to convince him for 100. Go for 100. Why 50? If they've come for filler 1 ml, they would convince no, go for 3 ml. So in that case, patient को आप day 1 पे तो आप overdo करके चले जाओगे. But in the long run, patient won't be happy with you.
Of course.
He won't turn up to you again and again, and that is just a 1-day match you are playing with the patient. He's not coming back to you. So I always advise go underdosing for the first timers. Slowly they get adapted, they get habitual to it. Then next time they would only say, I want 2 ml at one go. I'm fine with that. So that is what I always presume. I never go, overboard for fillers and Botox. I always undertreat. Same with threads.
Okay.
Threads are also used for lifting of the face. They're just like pillars for lifting.
Okay.
Like if a patient requires a lot of sagging is there, if a patient requires filler and thread both. Sometimes first we put threads that will just lift up the too much sagged skin, and then we fill in volume after a few weeks. That gives enhanced results. So similarly, threads also I don't put 10 threads in a day, 10 threads here, 10 threads there. I always undertreat it. Do the threads, see the results. Then patients feel थोड़ा और lift हो सकता है यहाँ. Let's put 2 more. Then that is the way. Then if required to fill the volume, then we fill the volume later on.
तो ये बोटॉक्स, फिलर्स और थ्रेड्स का डाउन टाइम कितना होता है डॉक्टर?
See, डाउन टाइम कुछ भी नहीं होता.
अच्छा.
There's zero डाउन टाइम.
हाँ,
बोटॉक्स का रिजल्ट आने में आपको फुल फ्लेज रिजल्ट दिखने में लग जाएंगे अप्रॉक्स 7 to 10 days or maybe 15 days in few cases. But ऐसा कोई डाउन टाइम नहीं होता. Worst what can happen is a single point can bruise. Okay. That is something very much fixable in a day or two. You do icing, you apply spike, it would go. That is the worst thing that can happen. That is also rarest of the rare. Like suppose I'm injecting 20 points here, किसी एक point पे bruise आने के chances हो सकते हैं. Otherwise there is no downtime. Very same day patient can go out, can socialize, you can go anywhere. There is no restriction that you cannot go या face पे कुछ दिख रहा है, nothing. Similarly filler का full fledged result आने में लग जाता है 3 to 4 weeks. That is the time it takes for the filler to absorb the excess filler, spread it out and give you a nice lift. But as such downtime कुछ नहीं है. Same day you get it done and you go out for a party or any gathering you can go.
एंड डॉक्टर मोस्ट इम्पोर्टेंटली ये कितने टाइम तक लास्ट करते हैं? बोटॉक्स फिलर्स का इफेक्ट हमें कितने महीनों तक लास्ट करता है?
See, Botox would last somewhere around 4 months to 5 months, and fillers, there are different types of fillers depending on the viscosity and the molecular weight, how thick the filler is. Like for face, they'll give you a thicker fluid. For mid face, they'll give you a little milder. So on an average, all the fillers last somewhere between 9 months to 18 months.
Okay. And threads, doctor?
Thread is also something that will last for approx 6 to 9 months. You can repeat after that.
Okay. Now talking of the latest fad, which is all over the net, the salmon sperm facial done by Kim Kardashian. So, doctor, is it really effective, and what is it exactly about, and is it for all kinds of skin types, and how safe is it?
See, salmon sperm facial is something that is quite in these days. Originally, it's from Korea. As you know, Korean skincare and their products have been quite a hype here all over the world. Salmon sperm basically is meant for PDRN, that is polydeoxyribonucleic acid. Okay, the salmon sperm contains a DNA that is quite similar to the human DNA that is commonly found in skin. So when we put that in your skin, there are two methods to put it. Either you just apply it and just infuse with microneedling, that is needle-less procedure, or can be given like a meso injections, very superficial, is just put under the skin, very superficial layers. So once it is in there your skin, it mimics the action of DNA, it mimics the nucleotides action, it gives your skin the raw material amino acids to produce its own collagen. In turn, your skin will make its own collagen, hyaluronic acid, and it will give you tighter, lifter, plump, and a taut face without being artificial. Like Botox and filler is something you put in and within 2 weeks your face is lifted and you see little bit changes in your features and expressions as well. This is something you won't give such an instant result within a week or two. Requires little bit multiple sessions at regular intervals. Over the time your skin will produce its own collagen. There'll be lift, there'll be glow, there'll be anti-aging benefits, there'll be shine, but everything will come eventually, slowly, naturally. No artificial look, and whatever your skin makes would persist for long, because something that your skin is preparing naturally. So it's got very good results, almost painless, requires multiple sessions initially, then later on you can go for yearly or 6 monthly for maintenance phase. So this is something that's quite in these days. We are also doing it at our clinic and our patients are really happy with it. It's for those people who want anti-aging, shine, glow, but scared of Botox and fillers, and we want something that is natural, stays with us for long.
Got it. So initially, how often this needs to be done, doctor?
Initially 3 sessions you require 3 to 4 weekly.
Okay.
After that, every 6 months for the maintenance phase.
Okay.
Because it's something like aging will be there. Your skin will lose whatever the new collagen is made up slowly, gradually, because aging process is going on, it will go on depleting. So just to give a little bit of top up for those amino acids, nucleotides, so that your skin keeps on boosting that collagen. So it's like maintenance after every 6 monthly, or few people go for yearly as well.
And there's a lot of talk about the vampire facial also. So what is your take on vampire facial?
Vampire facial is something very good results. It's got good results, but got a single side effect is downtime. There'll be downtime. Your face will be red, little bit swelled up for 3 to 4 days. If you can tolerate those 3 to 4 days, it's got fantastic results. It's just like PRP. We do PRP for face and hair also. So we take your own blood, extract the stem cells and growth factors in your own blood, put it all over your face, and then we infuse with the microneedling. Microneedling, as you all know, it boosts up your collagen. It causes micro injuries on your skin that causes skin to produce collagen. It gives you anti-aging, rejuvenation. So vampire facial is also something that people are quite doing these days. Got very good results. Can be repeated monthly or maybe 1.5 or 2 months also. In between you can keep on taking some other sessions. But it's got very good anti-aging, glow, rejuvenation, pigmentation. It works on almost every issue.
Now coming to another very interesting topic, talking of hair. Hair is the crown that we all wear and everybody wants to have those beautiful hair. But considering the climate that we live in and age factors, harsh chemicals that we expose our hair to, so a lot of hair fall happens for one and all. depend, and there's no age bar. All kinds, even kids suffer from hair fall, people in their mid-age or even elderly people suffer from it. So other than the common lotion, serums or the off-the-counter tablets that are available, what is the right kind of treatment that we should go in for to prevent this hair loss?
First, you need to identify the cause for your hair loss. Is it some nutritional deficiency? It is due to some hormonal changes, or is it genetic, or is it due to age related? So depending on the cause, you give the medicines and the lotions. Still, if you're not experiencing very good regrowth, you want a little bit of more regrowth, so you can always opt for some procedures like PRP, GFC and exosomes. PRP and GFC were quite old, but exosome is something quite recent, and there's a buzz about exosomes also. People have been doing, and we're also getting very good results. What is GFC and PRP and exosome? I'll explain you quickly.
Yeah.
As I told you, for PRP, we just take blood. Same, we go for Barefaced. We take your blood just like the way we take for a blood test. We extract your own stem cells, platelets from your blood, and then we inject that over the required area. Wherever there is density loss, we inject those over there. This is PRP. What is GFC? The blood vials that we take, in which we take your blood, they are already pre-filled with market-bought growth factors.
Okay.
They're pre-filled growth factors. So here, the number of growth factors that have been injected over your scalp in a single session would be 3 to 4 times more than PRP. And now coming on to exosome. Exosomes are stem cells which are in billions, 10 to 20 billion stem cells in a single session. Combined with PRP, when it is injected over your scalp, it will give you like 100 times more stem cells in a single session.
Okay.
Basically, we are just providing your cells, your hair roots, with stem cells and growth factors to stimulate dormant hair roots to, make new hair, and the hair roots that were already there making finer, lighter hair to improve the density. So over the time, when you take multiple sessions of these, you will see your hair growth has increased, your density would improve, plus the existing hair length that will also get little bit thicker in the texture, quality would also improve.
So ideally, how many sittings, doctor, does it take for the results to show up, at least considerable amount of results?
That also depends on the amount of hair loss a person is having. On an average, you require minimum 4 to 6 sessions minimum. If you have a little bit more hair fall and you want better density, then you can go for up till 10 also, or maybe more. So, but minimum cutoff is 5.
And does it have any side effects?
No side effects, just transient. At the time of, just putting the injections, for a very short time, there'll be a little bit of pain, little bit of discomfort can be there for some patients, not everyone. Those who have a good pain tolerance don't even feel anything, but very few patients would complain like during injection, we were little uncomfortable. Obviously, needle jayegi, thoda pata chalega. Although we apply numbing cream, we use the, ice packs and all of that to, soothe the pain. But still, there'll be a little bit of sensation that needle is going in. That is just transient, momentary. The moment my needle is off, pain is gone. No side effects, no downtime, no special post-procedure care, nothing.
So doctor, can you tell us that which is better? Like we've always heard about hair transplants. Now these exosomes is something which is new that has come. So what do you suggest? Which one is better and which one we should go in for?
See, if someone has completely bald patch, like this Anupam Kher jaisa scalp hai, then exosome won't do anything.
Okay.
Hair roots hai hi nahi, is completely bald. In that case, aapko hair transplant is your first option. If you have little bit of hair loss, like grade 2, grade 3, grade 4 तक भी hair loss है अगर, androgenetic alopecia के grades होते हैं, there are stages. Like अगर आपका stage 2, stage 3 तक भी आप हो, तो still there is hope कि exosome would work, but not as much as hair transplant. Hair transplant is a surgery. In a single day, you just go to the doctor's clinic, सारे बाल आपको लग गए, and you're back home with your full hair. Okay, but also that requires care. A lot of long post-procedure care, PRP sessions, सब उसमें भी चाहिए. And at times कुछ hair लोगों के गिर भी जाते हैं. It doesn't stay. Like 100% जो बाल लगाए हैं वो stay नहीं करेंगे. So if you are someone who has still grade 3 hair fall, थोड़ा bald patches आने लगे हैं, not completely clear, then I would always advise first go by these conventional therapies, like non-surgical options which are there. They can also give you good results. If someone desires कि मुझे तो 100% regrowth चाहिए जितने मेरे teenage में होते थे, मुझे तो वही चाहिए, then there is no doubt about it. Go straight away for hair transplant. If you're okay कि हाँ मेरे जितने गए हैं आई एम फाइन कि मेरा 70% तक भी बाल वापस आ जाए तो आई एम फाइन विद इट, देन गो फॉर दिस. ऑल्सो सम पीपल आर स्केप्टिकल अबाउट सर्जरीज. उनको ये भी होता है इट्स अ प्रॉपर सर्जरी के लिए जाऊँ ना जाऊँ, तो वहाँ ऑल्सो दे ऑप्ट फॉर दीज नॉन सर्जिकल ऑप्शंस.
थैंक यू सो मच डॉक्टर अपूर्वा. आज आपने हमारे व्यूअर्स को इतना सारा ज्ञान दिया है अबाउट स्किन केयर, अबाउट डिफरेंट काइंड्स ऑफ ट्रीटमेंट्स एंड अबाउट हेयर लॉस एंड हेयर ट्रीटमेंट्स. सो थैंक you so much being on our show. And if you like this episode and got some knowledge, do subscribe to my channel. Also like, comment and share. Thank you.